So when I went through medical school, I noticed that there are so many gaps in the healthcare system that even if I set out to become the best doctor that there is, that I'll always be held back by systemic limitations within the way healthcare is currently managed and delivered. So I had a choice to make, to either be the best doctor in a broken system or to actually fix the system so that every other doctor that comes after me has a much better experience delivering care.
Me sitting in an office, seeing people one by one, and then sending them right back out to the very thing that made them come in. I mean, that's revolving door medicine, and it was not going to really make a difference. And the need is so big and so profound, and I felt, to me, the only way you could make a difference is by being able to change the very systems that were creating this dynamic and not try and mop up the water without switching off the tap, in essence. So I felt at that particular point that I really wanted to dedicate myself to how do you switch off the tap?
I'm sure there are many people like me in the world who want to innovate, who want to bring about a change. Believe me, it's a long and difficult journey. When I started Operation Asha, there were two roads in front of me. One was the conventional road, that of surgery, and there was a lot of money and glamour and dazzling lights. And the other was the uphill task, where there was absolute hard work. There were rocks, and there was a rocky path, and there was darkness. And when I chose that, if someone were to discourage me, it would have been very difficult.
In the past, people have told me, why do you have to do it that way? We've already been doing, our community screening, etc., that way. Yeah, but I don't believe that it's enough. See? So I want to effect a change on a wider scale, and one must have the guts to do it, even if it's not initially accepted.
So I heard a baby cry, and it was crying relentlessly, not stopping. And I went outside, and I found this elderly lady, holding a baby in her arms. And I asked, it was obviously not her baby, and I asked her, whose baby is this? And then she said to me, it's my daughter's, it's my grandchild. And I said, where's the mother? And she said, she died 2 weeks ago. And my heart just went out to her. And I asked her, I said, why didn't you take this baby to the hospital? She said, I did, but there was no medicine. And at that point, I just said to myself, you know what? Someone just has to do this. And that someone is me. So I will stay. I'm not going anywhere. And that was it. Now here I am 3 years on, and I'm still doing it.
A clinic is just somewhere up there. Matter of 15 or more kilometers. It's just very far. Really very far from here, just very far. Now, many cannot afford to pay. So they force themselves, they were forcing themselves up to that place, covering such a distance. Sure.
Everybody's focusing on the patient and how they can cure these people, but no one is focusing on how to get these services to the people. So I think that is the missing link.
We can promote interventions, but if there's no accessibility, if people are not able to access the service, you cannot blame them for the lack of change of behavior or attitude.
Imagine a patient who's living in the tribal areas. They have to walk through the mud and wade through streams, maybe then catch a bus if they have the bus fare, if at all, and then reach the public center maybe at 10 or 11, and spend the rest of the day and then get back dead tired and exhausted at the end of the day. And then they have to go again after 48 hours. I wonder how they can do it.
I'm really passionate about getting a service that has been considered to be out of reach of our target group to them, to build a clean, welcoming facility that is well equipped and with people who are motivated and who are providing great service to what is considered a low-income sector that does not receive this kind of service.
Our role actually is to be, members of the government. We can't say that I'm private, you're government, you're separate from me. We are all part of this government. And as part of this government, our role is to be actively, doing something about problems and not just complaining.
I always believe in involving the community and have the community own projects. It's so beneficial. And investing in community-led interventions can really make a bigger impact.
Instead of this charitable mentality of waiting until someone pulls you out of the mud that you're in without you participating in the work, we've seen them realize that no, the development that we seek depends on us. We want to see more patients. We better get to work, improve upon or build upon the knowledge that we already have and serve our communities in a better way. If we serve them the best way, word of mouth, we get more revenue, and so we don't have to wait for the government to give us XYZ funds. We get to generate them ourselves. So the empowerment, I think, is a powerful way that our organization has impacted the clinics that we work with.
It's not that we necessarily set out to be innovative, we actually set out to solve a problem. But we believe that you must do that by really stripping it down and really looking at what's the actual issue and then trying to come up with a solution. By doing that, I think ironically, for us, we found we end up getting the label of being innovative by doing that, because then we end up with solutions that often don't look like what other people have typically put forward to address such problems.
In terms of formally studying innovation, this is also where our medical profession and public health officials are often, it's not our forte, and this is where the business community, entrepreneurs have really looked carefully at what goes into that ecosystem to create innovation. And this is an area where I think medical and public health professionals can learn a lot from business leaders.
We are, in our way, showing that even at the most primary level, you can address people's needs in a profitable way and in a sustainable way. It just takes being very keen on listening to the patients, to our customers, listening to what they need, what they want out of a healthcare provider, and aiming to meet that need every day at the most efficient level in order to make a return while keeping to all the regulatory needs.
Faith, right? I believe a biggest aspect of what we do is calling, knowing we're called to be here and to walk with our partners until they're transformed.
It's all about partnerships. And I think it's about time that NGOs and governments realize that we're not on opposite sides of the fence. We are working towards a common goal, and we should work together.
So when we trust each other, when we work together, we can build a health system that can deliver to the people.
The thing what gives me joy is really seeing the vulnerable communities now with improved health. We've seen the indicators changing. We've seen them opening bank accounts and being self-reliant and being invited by their leaders. And that reduced stigma, I think that is really huge.
I've got a desire to turn nurses into entrepreneurs, because I know nursing is one of the most satisfying jobs, providing care. And if you can love what you're doing and also earn a living and be comfortable and independent while you're doing it, I think that would be a great thing.
I think the message is that of hope, like change is possible. I know Africa is branded as, a continent of so much need, and Burundi that much more so. I mean, our health statistics speak for themselves. But I think my message is it's possible. You just have to believe in it, persevere, and do it.
I'm inspired by people working hard to change people's lives for the better, doing good for the community, like I do.
Don't put boundaries on yourself. Let boundaries come from outside, but don't put them on yourself. You've already then defeated yourself before you're out of the starting blocks. So go out there and try and make it happen. And half the time, guess what? We actually succeed.
It's important for all of us as innovators to look for those points along the way that tell us, yes, you are on the right track. Yes, you will succeed. And that part of the journey is what we need to really take as our motivation that we're doing well. Don't wait until the end of the journey. You may die waiting for the end of the journey.